Hi guys, welcome back. We're gonna talk about how are we supposed to give the fluids to the patient who is admitted to the hospital, right? In the previous video, we have discussed how to correct the deficit, how to give the maintenance dose, and how to calculate the maintenance dose. In this, we are going to see how are you supposed to give the fluids. Obviously, we know okay, we will give 2500 ml per day or whatever, per ml or per ml per hour or ml per day. We know that we are supposed to give, but how how are we supposed to give? We are supposed to give IV for sure, but what is the drops? How much drops you want to give it, right? That is known as drops per minute, dpm, right? So very important is this. There are two formulas, as we know, right? If we calculate in ml per hour or we calculate in ml per day, right? So if you do ml per day, whatever is the ml that is coming in your entire day, that is your maintenance dose. Let's say it is coming 2600 ml per day. So what is the drops per minute? Very simple. Select this 26. Let's say it is 3000 ml per day. What is the dpm? 30 drops per minute, right? If it is 2700 ml, what is 27 drops per minute? If it is 2800 ml, so it is the drops per minute is 28. If it is 2900 ml per day, so drops per minute is 29. If it is 30, then 3000 ml per day, it is 30. If it is 3500 ml per day, it is 35 drops per minute, right? Or if we have used the another formula, is we have calculated in the basis of ml per hour. So how are we supposed to do it? Whatever the ml we have calculated, let's say we got 100 ml per hour, so we will just directly divide it by 4. Okay, once we do it, we'll get 25 drops per minute. You can follow any formula. I preferably follow this formula. I find it more easier, and this is personal choice. Okay, you can follow any two formulas. Either you can calculate ml per day or you can calculate ml per hour. That is up to you, right? There can be a discrepancy of 100 ml or so. That is not going to affect the patient as well, right? So once we do it, we want to see what are the types of fluid. What are the types of fluid? If you divide types of fluid, we will be getting mainly three types of fluid. We have crystalloids, we have colloid, and we have blood and its products. Is that right? Okay. So in crystalloid, again we have isotonic, hypotonic, and we have hypertonic, right? And isotonic, what we having? We're having ringer's lactate, normal saline, that is 0.9%. On hypotonic, we are having 5% dextrose. Hypertonic, we are having 3 normal saline, and also we are having another that is known as Darrow solution, right? And in isotonic, we also have another one that is known as plasma light, right? So please remember, whenever there is a shock, we always want to give normal saline, but nowadays the preferred one is we are supposed to give is this 3 normal saline, right? We are supposed to give 3 normal saline. If that is not available, we'll go for normal saline, right? Now what are this colloid? Very simple words, I just want to tell you, this synthetic protein. Is that right? Synthetic protein. And on the blood products, what are we having? We're having a lot of things here. We have whole blood, we have fresh frozen plasma, we are having platelets, we are having cryoprecipitate, and we are also having what are we missing? Yeah, packed RBC. Is that right? Packed RBC, cryoprecipitate, platelets, fresh frozen plasma, and the whole blood. Please remember, whole blood we cannot give to a patient who we need to give him in a massive amount, right? In massive blood transfusion, we will not give this whole blood, right? Now what about this colloid? This is known as synthetic protein. Very amazing, this thing. It is very effective in hypotension. Before that, we in hypotension we give this colloid. Just I will want to give you an idea. Imagine this is the blood vessel, right? Imagine this is a blood vessel. Remember, your blood vessel is not having complete sealed blood lines, right? It is having small holes. These are known as fenestration. Okay, this is microscopic holes are there. There is mainly two rules, right? Ideally there's four, but I'm going to tell you two. The fluid inside the blood vessel will stay inside the blood vessel because of two reasons. Okay, one is oncotic pressure. Oncotic pressure. Now, what is this oncotic pressure? It is achieved by protein, sugar, salt. What kind of protein? Mostly albumin, globulin. Right? This is what it is going to be achieved. Now, what is this oncotic pressure? Just remember, any place where there is high oncotic pressure and there is less oncotic pressure on a side, the water will move. The water will move from low oncotic pressure to high oncotic pressure. That's a rule. Okay, there's another rule. If there's increased hydrostatic pressure and there's one side is reduced hydrostatic pressure, the water will flow from increased to low hydrostatic pressure, right? Imagine this is a blood vessel. Again, we are having a lot of pressure here. Okay, you have given a lot of massive amount of fluids here. This fluid will leak out because this increased hydrostatic pressure. Remember, water will flow from high level to low level, and if there is high oncotic pressure and low oncotic pressure, from low oncotic pressure it will go to high oncotic pressure. This is the flow of fluids. And or if there is high hydrostatic pressure to low hydrostatic pressure, it will come from high to low. That is what you have to remember. Okay, now very important. Now here, imagine the patient is having hypotension. Imagine the patient is having hypotension. What is hypotension? Hypo means less, tension means blood pressure. So there is less amount of fluid inside the blood vessel. So we are giving this colloid. Now what is this colloid? It's known as synthetic proteins. Okay, artificially made proteins, synthetic proteins. You can say in either way. So you are giving this synthetic proteins. What is it is going to do? What is the main function? As I told you, this proteins will increase the oncotic pressure. So increase oncotic pressure. What will happen if there's increased oncotic pressure? Fluids will come inside the blood vessel, right? So what will happen? Increased blood pressure. Hypertension is corrected. But very importantly, you have to understand one concept about if you are giving colloids in shock, the patient may die, right? Why? In shock also we are having, sometimes we will be having less amount of tissue perfusion, right? The blood pressure may come down. Initially in any shock the blood pressure is normal, then later it comes down because your body tries to compensate by increasing the pulse rate, increasing the increasing the heart rate. Then after that it fails, right? So why in shock you're not supposed to give colloid solutions is very important. Is that whenever you're having shock, right? Whenever you're having shock, there are damage to this endothelial lining, right? There is damage to endothelial lining, right? There is damage to endothelial lining. So what happens? You have given the synthetic proteins. So this is given here. So what will happen? It will leak out by the damaged surface of the endothelium of the blood vessel and will deposit here outside the blood vessel. So what it will do here? It will increase the oncotic pressure here. So what will happen? The oncotic pressure is increased outside the blood vessel. So as I told you, the fluids will move from less oncotic pressure to high oncotic pressure. So what will happen? The remaining fluid that is inside the blood vessel, already there is less amount of fluids. So this fluid will come out of the blood vessel. So you are making the condition more severe, more worst, right? So never ever give colloids and patients who are having in shock, but this can be given to patients who are having hypotension. So please remember, shock will have damage to the endothelial lining. If you give, you will damage it. But in patients who are having hypotension, you can give colloid. So it's very critical that you try to understand this. Okay. All right. So this is the basic understanding that I wanted to tell you guys. And also, if you want to talk about more in the pediatrics age group, right? If you want to see for the what is the calculation of fluid IV, if the patient is less than 1 year, so at that time you are going to give 30 ml per kg body weight in 1 hour, and then 70 ml per kg body weight in 5 hours, total 6 hours. If the patient is more than 1 year, you're going to give 30 ml per kg body weight in 30 minutes. Please remember this is 30 minutes, and 70 ml all in 2.5 hours. Please try to appreciate, we are giving the same amount of fluids, but if it is less than 1 year, we are giving in 5 hours and 1 hour, that is total 6 hours. If it is more than 1 year, 30 and 70, we are giving this in 30 minutes, half of the time, and here also we are giving it in half time. So overall this comes 3 hours, and this is 6 hours. So just to one technique that you can remember if you get confused, just remember more than 1 year, right? So if the baby is more, so it will require more amount of fluids and very very fast, right? If you're a big person, so you want more fluids to be consumed faster. So this is what you need to remember, right? So this was a small video about this. Please remember how are you supposed to calculate, and what is the drops per minute you're going to give, and what are the fluids that you're supposed to give. And in shock you can give normal saline, but better is 3 normal saline. And in colloids you're very very effective in correcting hypotension, but do not give this in shock, right? And what are the blood products? You should be understanding this. Please do not give whole blood in massive transfusion, right? 3-4 units if you are giving or more, kind of. Do not give this whole blood, right? And please try to understand the concept of this oncotic pressure and hydrostatic pressure. More oncotic pressure, fluid will flow towards more oncotic pressure. If there's high oncotic pressure, high hydrostatic pressure and low hydrostatic pressure, the fluids will move from high hydrostatic pressure to low hydrostatic pressure. That is what you need to understand, right? And please remember, blood vessels are not completely sealed, kind of like, it's not like a pipe, okay? It's having multiple holes. There is fluids are staying inside because of these 2 laws, right? Ideally there's 4, but I'm telling you 2, right? That is what I want you to guys to understand, and that's all for now. Thank you.